For babies like these preemies, it's critical to have the right-sized equipment to make sure they get the care they need. Phoenix Children's Hospital fills that need for children of all ages right here in Arizona. Welcome back, everyone, to our very special show here at Phoenix Children's Hospital. And when it comes to battling cancer, there is nothing more frightening than for a parent to hear that their child may have a brain tumor. I can't even imagine. Joining me right now is Dr. Amy Rosenfeld from the Center for Cancer and Blood Disorders. And thank you for being here. I know you're a very busy person, so we appreciate it. We want to talk first about what is a pediatric neuro-oncologist exactly?
A pediatric neuro-oncologist is somebody who is trained in pediatrics, has completed a residency in pediatrics, has also completed a fellowship in hematology oncology, and then in some cases has gone on to do a fellowship specifically in pediatric neuro-oncology.
And I know that Phoenix Children's Hospital was very excited when you came here. Talk about why you came specifically to this hospital.
Currently, Phoenix Children's Hospital has a comprehensive brain tumor program, which really helps give the best care to these patients. They have neuro-oncologists, they have neurosurgeons, physical therapists, rehabilitative medicine, a wonderful nursing staff and social work staff to really provide the best care for these patients.
Unbelievable, yeah. It's amazing because the patients that you see, we're talking about young kids with tumors. Very young. I mean, what's the youngest you've ever treated?
Probably just after birth, shortly after birth.
Wow, that is amazing. You were doing something called the Phase 1 trial. What is that?
Well, currently about 2,000 children in the U.S. are diagnosed with a brain tumor. Currently with our therapies, some brain tumors are not curable. The advantage of a Phase 1 trial is that we can provide what we think might be the best upcoming and the most up-to-date therapy for these patients in hopes of finding a cure. So Phase 1 is really where it all begins.
How can somebody participate in that? Would there be a patient here at the hospital?
Any patient with a brain tumor that is recurrent or for which there is no cure is eligible for a Phase 1 clinical trial.
So it's very important to figure out what we can do to help these young children. And you said some come in at birth they have a brain tumor. And you can go ahead right in there and do something immediately.
It depends upon the tumor type, it really does. But there are options out there for any age that has a brain tumor. So, I think this is a great program. I'm excited. I think we're growing, and I think, our clinical research program is just really, it's really taken off, and I'm really excited about it.
Well, we are very fortunate to have doctors like you here who do this kind of work. I can't imagine as a parent what you must go through, but thankfully you can come to Phoenix Children's Hospital, get the best care, the best treatment, the top of the top of what's happening in the field right now to make sure that your child has their best odds of surviving. Thank you so much for joining us. I know how busy you are, so we really appreciate it.